Hello, hello.
जी सर।
How are you? Are you fine?
जी सर।
Yes. So we are today also discuss regarding the private question.
Assalamu alaikum, sir.
Walaikum salam. So we will discuss board one. I think board one question, card number 17, and so from board one, card number 1 to 16 has been discussed. And today we'll discuss 17, 18, 19. And another 3 cards will be left in board 1. I think total 9, 10 cards is going to be discussed in 3 classes, 3 or 4 classes. Later on we will select what we should do. So today, card number 17, and our first question is give the clinical picture of scabies and how it is diagnosed. The scabies you will suspect when there will be intense itching. Intense itching. And itching is the predominant symptom of scabies. And in adult, you will get maculovesicular, not macule, papulovesicular rash, not macule, but papulovesicular rash in interdigital space of hand and external genitalia. Groin and external genitalia, these are the common site of affection of the scabies. But in children, the scabies in children, the pustular rash in palm of the hand and sole of the foot occurs. So the presentation of adult and children is different. And diagnosis is made by extracting the mite from the burrow in the interdigital space by blunt needle. By blunt needle, you can extract the mite of susceptible scaby and see under microscope. This is the confirmatory diagnosis. Our next question are what are the sclerosis? I think you know the multiple sclerosis is a demyelinating disease. Demyelinating disease means loss of myelin sheath in the nerves, the spinal nerves as well as the central nervous system or brain. Tracts of the brain and the nerves of the spinal cord are demyelinated in multiple sclerosis. So the first presentation is weakness in the both lower limbs. That is called paraplegia. So paraplegia is a feature of multiple sclerosis. And other feature are your ataxia. Ataxia means loss of equilibrium of the body, or abnormal gait. And third is tremor. And fourth is sensory symptom which relapse and remission. The symptom appears and lasts for few weeks, and later on it disappears. Again it reappears. So at least 3 times in a year it can occur. So this is the relapse and remission of the sensory symptom is a feature of multiple sclerosis. Another is progressive paraplegia in the lower limbs. So these two are the characteristic feature of multiple sclerosis. And optic neuritis, not neuropathy, optic neuritis. optic neuritis means there will be pale discoloration of the optic nerve and there will be loss of vision. And nystagmus is the involuntary oscillatory movement of the eyeball. And there may be recurrent facial palsy and trigeminal neuralgia. So these are the different presentation of your multiple sclerosis. And next question is, how will you treat multiple sclerosis? So there are different stages of treatment. Some are general measures. Number one, physiotherapy. Second, catheterization, because the patient may develop retention or incontinence of urine. And diet, gluten-free diet. Barley is a gluten. So this gluten-free diet is preferred. And hyperbaric oxygen therapy. Oxygen therapy is needed in some of the patients. Specific treatment. In acute stage, it is given by methylprednisolone, 500 mg IV daily for 3 days. Oral prednisolone is not nowadays advised. Methylprednisolone is the drug of choice. Previously, oral prednisolone was advised, but nowadays methylprednisolone, pulse therapy of methylprednisolone can be given on different occasion or during exaggeration of symptom or acute stress. It is given, not oral prednisolone. And to prevent relapse, we can give azathioprine. It is a immunomodulating drugs. And another is beta interferon. Beta interferon nowadays introduced, and natalizumab. It is the latest drug. Natalizumab. It is the latest effective drug in multiple sclerosis. So, in acute stress, the patient should be treated by injection methylprednisolone 500 mg to 1 gram IV daily for 3 to even 5 days we can give it, and it can be repeated after 3 months if symptom recur. And to prevent relapse, azathioprine is the drug of choice, but beta interferon and natalizumab, though better drugs, but it is very much costly. And now treatment of complication of multiple sclerosis, there is spasticity because there is upper motor neuron lesion. So we have to give physiotherapy and baclofen. Baclofen is a muscle relaxant. And for ataxia, we can give clonazepam. And for bladder symptom, we can give self-catheterization and tablet imipramine. Self-catheterization and imipramine. And for fatigue, amitriptyline, and for impotency, sildenafil. These are the different drugs used in complication of multiple sclerosis. Next is how you will treat benzodiazepine poisoning. General measures: ABC resuscitation, airway clearance, breathing and circulation, and gastric lavage if patient comes within 1 hour. And a specific treatment, injection flumazenil is the benzodiazepine antagonist. Benzodiazepine antagonist. Our next question is how we will treat TB meningitis. And TB meningitis is treated by 4 drugs, 4 anti-TB drugs: rifampicin, INE, citambital, and pyrazinamide. Rifampicin 450 mg, INH 300 mg, citambital 800 mg, and PZA 1500 milligram. And tablet pyridoxine 20 milligram daily for 6 months. And prednisolone 1 milligram per kg body weight daily for 1 month. Antimeningitis, if patient is unconscious, then we can maintain ABC. And digestic feeding in patient cannot take orally, and catheterization if patient is bedridden. What are the drugs used in Parkinsonism? Levodopa carbidopa combination 110 milligram. Usually it is given 50 milligram BD, that is half tablet BD, and increased according to response up to 1000 milligram per day. Gradually, after 3 days interval, we can raise the dose. And next drug is benjexol. It is a anticholinergic drug, 2 milligram on tap TDS. And third drug is amantadine, antiviral drugs. It is also effective nowadays, 100 milligram BD. Salicylic, another drug, 5 milligram single tablet morning. Bromocriptine 1 milligram tablet, 1 milligram daily, and it can be raised up to 2.5 milligram daily. So these are the 5 drugs: levodopa, benjexol, amantadine, salicylic, and bromocriptine. These are the 5 drugs used in Parkinsonism. But the most commonly used drug is levodopa carbidopa, and then benjexol, then amantadine, then salicylic, then bromocriptine. What are the effect of vitamin A deficiency? Eye change, night blindness, xerophthalmia, that is dryness of the conjunctiva, Pittot's spots. These are the whitish spot in the sclerocorneal junction, and keratomalacia, that is corneal ulcer, and ultimately blindness occurs. Next question is, how will treat SLE? Specific treatment of SLE, drug hydroxychloroquine 200 to 400 milligram daily, and if only skin is involved, skin rash is present, and NSAID if arthritis is present, and prednisolone 1 milligram per kg per day for 6 weeks, then gradually tapered and withdrawal. Indication, it is given in case of vital organ involvement like kidney, brain, lungs, heart. So when vital organ are involved, then prednisolone is given. But sometimes the steroid injectable form, methylprednisolone, is given 500 to 1 gram IV, IV 3 weekly for 6 to 8 doses. And it is given in life-threatening disease of the kidney when the massive proteinuria occurs. And other drugs in life-threatening kidney disease, central nervous system disease, cardiovascular disease are also treated by cyclophosphamide along with methylprednisolone. So first of all, if there is rash only, then hydroxychloroquine. If arthritis, only NSAID. But if kidney is involved, involvement of the kidney, then oral prednisolone. But if severe kidney disease, CNS involvement, cardiac involvement, then methylprednisolone with cyclophosphamide. So these are the different options of treatment of SLE. What are the complications of dengue fever? Dengue hemorrhagic fever. If dengue causes hemorrhage, in the form of purpuric spots, epistaxis, subconjunctival hemorrhage. It can cause hematemesis, it may cause intercerebral hemorrhage. So then it is dengue hemorrhagic fever. But if dengue causes hemorrhage at the same time produces hypotension, it is called dengue shock syndrome. Hepatitis also occurs as a complication of dengue fever. How will we treat dengue fever? Uncomplicated dengue, only paracetamol, no other drug is required. But if complicated dengue like dengue shock syndrome, dengue hemorrhagic fever, that is treated by blood transfusion, platelet transfusion, and normal saline infusion. And in hepatitis, no drug is used. Now, card number 18. What are the major criteria of rheumatic fever? Rheumatic fever, the first criteria is migratory polyarthritis. This is the commonest presentation of rheumatic fever. And migratory polyarthritis, usually large joints are involved. Large joints are involved. And it is migratory because for 3 to 5 or 7 days, one joint is involved. That joint and get relief, then another joint is involved. It is called migratory polyarthritis. And sydenham chorea. Chorea is a dancing movement. Sydenham chorea is a variety of chorea. Carditis, it may be the pericarditis, it may be endocarditis, it may be myocarditis. But the commonest presentation is endocarditis. And usually the bulb, mostly the mitral bulb is commonly involved with carditis. Subcutaneous nodule. Subcutaneous nodule and erythema marginatum. These two are the skin involvement, and these are the 5 major criteria. Out of this, and single criteria is present, it is almost diagnostic of rheumatic fever. How will you manage rheumatic fever? Drug treatment. First of all, phenoxymethyl penicillin 250 mg, 1 tab 6 hourly for 10 days to eliminate residual streptococcal infection. To eliminate streptococcal infection, we have to treat the patient by phenoxymethyl penicillin orally 250 mg, 1 tab 6 hourly for 10 days. And prophylactic treatment, phenoxymethyl penicillin 250 mg 1 tab BD for 5 years or up to age of 18 years, or 1.2 million IM monthly for 5 years. So either phenoxymethyl penicillin or injectable penicillin. Any drug used is aspirin. Minimum dose 2 gram and maximum 8 gram per day till pain subsided. Prednisolone 1 milligram per kg per day is given if there is associated carditis. And general measures, bed rest till fever and joint pain subsided. So this is the treatment of rheumatic fever. How to control diabetes in stroke patient? Diabetes mellitus in stroke patient is controlled by insulin, injection insulin subcutaneously when blood sugar is more than 11.1 millimole per liter. So when blood sugar is mildly increased in a stroke patient, it should be treated by insulin, not the oral hypoglycemic agents. And diabetic diet should be given. But strict control as well as the strict monitoring of blood sugar to avoid hypoglycemia should be done. What are the complications of stroke? Immediate complication and late complication. Immediate complication is hospital-acquired pneumonia, which occurs within 48 hours of hospitalization. Thromboembolism and deep vein thrombosis, retention of urine or UTI, and convulsion, epileptic convulsion can occur. And late complications, bedsore, frozen shoulder, and depression. How will manage OPC poisoning? So this question is very important because repeatedly we got this question. And general measures, airway clearance by suction and breathing by oxygen inhalation, circulation by IV fluid, and prevent contamination by removing the affected clothes. Gastric labor is patient calm within 1 hour, catheterization, and maintain intake output chart. Specific treatment, injection atropine, 3 ampule IV stat, then repeat 15 minutes interval up to full atropinization. Injection diazepam 10 mg if convulsion present. Injection ceftriaxone 2 gram IV daily should be given. Injection pralidoxime 2 gram IV to combat nicotinic effect of OPC. And 4 ampule 2 gram IV slowly about 5 minutes, and it can be repeated if required. What are the micronutrients? Micronutrients are the inorganic and organic nutrients which is required in very small amount in body. Important micronutrients are vitamin A, D, folic acid, B12, B1, riboflavin, niacin, vitamin C, iodine. And these are the micronutrients that required in very small amount in our body. How does a patient present with vitamin A deficiency? We have already discussed this question. What is osteoporosis? Osteoporosis is a metabolic disease of the bone where there is a decrease in bone density and which causes microarchitectural deterioration of the bone tissue, leads to increased risks of bone fracture. So first of all, bone density is reduced, then deterioration of the microarchitecture of the bone tissue, and third, bone fracture occurs. These three things occurs. So first of all, bone density reduced. Second, there is deterioration of the bony structure. Third, there is chance of fracture of the bone. What are the common causes of osteoporosis? Osteoporosis mainly two types. One is primary, another is secondary. Primary is idiopathic in male senile osteoporosis. After 60-65 years, male suffers from osteoporosis. And in female postmenopausal women commonly are affected by this disease. And secondary disease causes of osteoporosis among the endocrine cause Cushing syndrome, hyperparathyroidism. So these three are the endocrine cause. One is Cushing syndrome, second is hyperparathyroidism, third is hyperthyroidism. And among the connective tissue disease, rheumatoid arthritis and ankylosing spondylitis. Among the GI tract disease, malabsorption and CLD. Among the drugs, the steroid and anticonvulsant. And among the blood disease, it is multiple myeloma. What is the presentation of enteric fever? Some change in first week. In first week, there is fever, continued fever, which rises step ladder pattern. And second is relative bradycardia. Relative bradycardia means along with temperature, pulse rate increases. But if temperature rises but pulse not rises, that is called relative bradycardia. And constipation or diarrhea can also occur in first week. In second week, rose spots, it is a vasculitic spots that found in front of the chest, and splenomegaly can occur in second week. In third week, usually complication occurs. GIT hemorrhage, perforation, delirium. Delirium, I think delirium, you know, it is a state where there is confusion and loss of memory occurs. Arthritis, meningitis, myocarditis, nephritis. So almost all systems are involved in your enteric fever. Among the GIT complication, GIT hemorrhage and perforation in nervous system, there is delirium, meningitis, and among the rheumatological system, arthritis, among the kidney system, nephritis, among the cardiovascular system, myocarditis. How will you treat enteric fever? The oral drug ciprofloxacin 500 mg BD for 14 days or azithromycin 500 mg daily for 14 days or injection ceftriaxone 2 gram 12 hourly for 7 days. What is the modern treatment of peptic ulcer? Treatment of H. pylori, Helicobacter pylori is the latest treatment of peptic ulcer. It is given by triple therapy. Among the triple therapy, amoxicillin 1 gram 12 hourly for 7 days, pantoprazole 20 milligram 12 hourly for 7 days, tablet clarithromycin 500 milligram 12 hourly for 7 days. So these are the triple therapy, and it is the latest treatment of peptic ulcer. And this last card, number 19. How will you treat benzodiazepine poisoning? This question has already been discussed. What is hypothermia? Hypothermia is characterized by low body temperature, that is less than 35 degrees centigrade or 95 degrees Fahrenheit. What are the features of hypothermia? In mild case, there will be cold skin, shivering, confusion, ataxia, dehydration. Cold skin, cold clammy skin, shivering. These two are the first presentation of hypothermia. And secondly, the patient may go to confusion, ataxia, and dehydration. But in severe cases, there will be hypotension, bradycardia, arrhythmia, depressed conscious level, and coma. What is ankylosing spondylitis? AS. It is a chronic inflammatory seronegative arthritis, predominantly affects the sacroiliac joint and spine of the vertebra, lower vertebra. So it is a chronic inflammatory seronegative arthritis, predominantly affecting the sacroiliac joint and spine of the vertebra. If these two joints are not involved, then it is very unlikely ankylosing spondylitis. What are the diagnostic features of ankylosing spondylitis? Clinically, inflammatory low back pain. Why inflammatory? Because inflammatory means the pain increases at rest and decreases with activity. It is called inflammatory. With marked stiffness, morning stiffness. And there is restriction of the movement of the lumbar spine. These two are the clinical criteria of ankylosing spondylitis. Radiological features: the squaring of the lower lumbar vertebra, marginal sclerosis, calcification of the anterior longitudinal ligament, and giving the appearance of bamboo spine. And X of the SI joint shows reduction of the joint space, and HLV 27 and positive. What are the commonly affected nerves in leprosy? It is also a common question. Posterior auricular nerve, radial nerve, posterior auricular nerve behind the auricle, radial nerve, middle of the humerus, ulnar nerve, medial epicondyle of the elbow joint, median nerve, along the wrist joint, common perineal nerve in the over the ventral joint, sural nerve, and posterior tibial nerve also. How will you treat multibacillary leprosy? Multibacillary leprosy is lepromatous leprosy, and it is treated by 3 drugs. One is rifampicin, and rifampicin is given 600 mg monthly for 1 year, and dapsone 100 mg daily for 1 year, and clofazimine 50 mg daily for 1 year. What are the presentation of subarachnoid hemorrhage? Subarachnoid hemorrhage is presented. Symptom of subarachnoid hemorrhage is sudden severe thunderclap headache. Thunderclap headache indicates the sudden and severe headache like thunder, and which lasts for hours to days, and it is associated with vomiting and occasionally loss of consciousness. And among the signs, BP may be high and GCS may be low, and features of hemiplegia or aphasia may present, that is photophobia, neck stiffness, third nerve palsy, and occasionally hemorrhage in the optic disc. Hemorrhage can occur in optic disc. What are the causes of ICH? What are the causes of ICH, intracerebral hemorrhage? One is severe hypertension, third is rupture of the perianeurysm, and third is anticoagulant therapy, heparin therapy. Fourth is arteriovenous malformation. So out of this, perianeurysm rupture is the commonest cause of intracerebral hemorrhage or subarachnoid hemorrhage. And name the antihypertensive drugs contraindicated in pregnancy. 2 drugs contraindicated. One is SC inhibitor, another is ARB, angiotensin receptor blocker. These 2 drugs are contraindicated in pregnancy. It should not be used in pregnancy. Name the drug of choice in hypertension with diabetic nephropathy. But these 2 drugs, SC inhibitor and ARB, is the preferred drug in diabetic nephropathy with hypertension. And this is the end of today's class. So my question to you, তোমরা কি ক্লাস ফলো করতে পারো? হ্যালো হ্যালো,
জি স্যার।
ক্লাস কি ফলো করা যায়
ইয়েস স্যার।
নাকি আরো স্লো বলবো? আরেকটু
না
স্লো
স্যার,
হলে
ঠিক
ভালো
আছে।
হয়।
না স্যার,
ঠিক আছে,
এরকমই ঠিক আছে।
এটাই
জি
ঠিক
স্যার।
আছে। থ্যাংক ইউ।
জি স্যার।
I hope and pray to Almighty God for your healthy life, and you continue your study. And when the class will open, then we will meet together and give you a lesson from the word class. Now you get preparation theoretically. Thank you. Thank you.